there to a live broadcast of The Only You, where we discuss mental health issues. Of course, like, subscribe, and share. Dr. Patino back from a vacation. Hopefully that was relaxing. We were chatting before the show, but we're going to talk about a subject that's near and dear, I know, to my heart and also to yours, because we have people in our families or close to us that suffer from something called ADHD. What is that?
Well, thank you very much. I'm starting to feel a little embarrassed because every time we have a new program, I'm coming back from a vacation, right? So it
Well
sounds
earned,
like,
though. After 30 some years of work, it's
yeah.
very
So
well
so
earned.
so it feels like, especially this summer, like I'm going on vacation a lot, which is nice. I'm really enjoying that. Let's talk about ADHD, and let's start by going to the basics. Of what is it. And it is really fascinating because we've known about ADHD since I was in medical school 30, 40 years ago, right? We have named it different things over the years. And there are very few disorders with children and adolescents and now with adults that cause as much turmoil and, and lack of understanding. So it's one of those things in psychiatry where everybody has an opinion, but very few people know the facts, right? So let's look at the facts. Let's see what we know today that we didn't know 40, 50 years ago, right? The first fact that is important, tremendously important for people to understand, is that ADHD is not a psychiatric disorder per se. It's a neurological, neurodevelopmental disorder. So that's a fact that I'm not making it up, right? Now, this is not the first time in the history of psychiatry that we have reframed things, right? If you look back in the 1920s, 30s, epilepsy was considered a mental disorder.
Wow.
And back in the in the medieval years, it was a satanic thing, right? You were possessed if you had epileptic seizures. So we have grown from that, but we have gotten to learn that attention deficit hyperactivity disorder, that's actually the official name. We used to call it about ADD. We used to call it ADHD.
So
We don't
so
do
it
that
is
anymore.
it's no longer two different things. It's one.
It's always been one thing,
Okay.
but we were saying ADD versus ADHD was the presence or absence of hyperactivity. We got rid of that, and now we have subtypes. But the second fact is that um, attention deficit hyperactivity disorder, let's call it ADHD, is a genetic disorder. It gets transmitted in families, and that has kind of serious implications. So, number one is a neurological neurodevelopmental disorder. Number two is a genetic disorder, one of the most highly genetic disorders in neurology and psychiatry. And it really is something that you're born with. Okay. So we call it attention deficit hyperactivity disorder because there are two sets of symptoms, right? We have obviously the inattention, and we have the hyperactivity, poor impulse control issue, right? So those two sets of symptoms are present in an individual very early in life. Now, that doesn't mean that we're going to notice it at the time the baby is born, but we notice it when the baby starts needing to learn. There are some features in some early stages of development that you may notice the kid being distracted, being irritable, but they're not really formally needing to learn.
But
You know,
what age group is that typically that you can start seeing those symptoms?
usually we start identifying the kids with attention deficit hyperactivity disorder in general when they start school, 6, 7 years old. Now, that doesn't mean that we don't see, or the child psychiatrists don't see ADHD severe earlier in life. But as a rule, most of the kids will be identified in school when they get into formal learning and they get into a very controlled environment. Right? Now, it's also important to understand that ADHD is not something that it is disabling per se, right? There are some rare cases in which the hyperactivity is so severe that the kid's not able to function. Kids are able to function, but they have difficulty learning. They have difficulty not reacting, not being impulsive. So it is actually a misnomer to call it attention deficit because it's a lot more than that. It's actually an executive function disorder that has a lot to do with attention, but it also has to do with problem solving. It also has to do with not reacting. It also has to do with listening, right? So there are a multitude of symptoms that we need to be looking for. But how do we identify it? Well, first, when the kids starting to learn, they gets distracted a lot, right? So they start making kind of careless mistakes, right? Because they're not paying attention. They're constantly changing their activities, so they never finish anything, right? So we have to um, keep an eye on that. They have a lot of difficulty with task-oriented situations, right? So if they had to follow a sequence, they may start and they may either jump sequence, okay, or not follow the sequence and go into something else. So those are kind of details that we see. The other part really has to do with the hyperactivity, and that has more to do with the kid reacting impulsively. Now, it's not always that the kid's moving all the time, right? Sometimes is that the kid blurs things out, right? So you're having a conversation with the kid and the kid's interrupting you, right? And it's not necessarily because there are ill intention. They're not trying to interrupt you. But if an idea comes to their mind, they have to say it. They don't have that ability to hold it in their cognition, waiting for their turn, right? So they're not very good at waiting for turns, right? They're not very good at doing chores, for example. I mean, the typical attention deficit hyperactivity disorder kid is a chronic procrastinator, you know? So they get home from school, right? And they have to do their homework. And you have this expectation that the kid's gonna have dinner, sit down, watch TV for 30 minutes, and then go and do homework. Then they take a shower. I mean, the normal routine of most kids in that age. But what happens is that they may get into having dinner, they do it very quickly. Then they go to the TV and they're watching TV for a long period of time. And then you tell them it's time to do homework. And the kid says, in a minute, in a minute, in a minute. And one of the problems, especially with electronics, is that kids with attention deficit disorder tend to hyper focus. So there's certain things that they will do with their hyper focus on one thing at the expense of everything else, right? So they eliminate everything else. So they look like if they're not listening to you. Well, it's not that they look they're not listening to you; they're not listening to you, right? So, and that's very frustrating for parents, right? Because immediately it's taking into it is a bad kid. It's not that he cannot pay attention or he cannot listen; it's that they don't want to.
Yeah, they definitely get labeled a lot. I know my stepdaughter has been labeled a lot, and I'm very easily identifying the person in her family that passed on that trait because I literally can walk around my own home and see things that have been started that never get completely finished. It's like a trail of breadcrumbs. uh,
Yes.
it's very obvious to see that, and to that point, I mentioned before the show, my stepdaughter, who you've treated in the past, has done relatively well for herself. She's in college now. We got her through high school and middle school. She's doing well. She's playing college soccer, but she has that one class. And that one class is the one that she has to pass to get her degree, and it keeps challenging her because the way it's set up really taps into that executive function part that you discussed. Could you tell us a little bit more about what that actually is?
Well, what happens is that in order for you to problem solve, you need a multitude of different functions, right? You need your eyes, you need your ears, you need to collect the information, you need to process the information. Then you have to come up with a solution that is a complex process, and then you have to verbalize it or implement it, right? So if you look at the number of steps that need to be followed in a situation like that, there are a lot of things that are happening. So kids will have a lot of difficulty with some of those steps, right? So the ability for them to retain information in short-term memory long enough to utilize it is like if you had a hard disk and you have RAM memory in the computer, right? And RAM memory is always holding information here that you're constantly using and you keep pulling it up when you need it, right? Well, the RAM information system is not working very well. Okay. So if that's not working very well, then they lose the information. They have to keep going back for it. Right? So while they're going back for that information that they now need to utilize to problem solve, they're missing the other half,
Mm,
right? So they're always missing something because they don't have the ability to hold information and to problem solve adequately. They're very good at problem solving quickly, right?
mm,
So if you have a simple situation, which is action reaction, they're excellent at that. And I have to tell you, because I've been doing this for a long time, I have patients who are athletes, whether it's football or baseball, or patients who are extremely intelligent, right? And they would have find ways to deal with action reaction very quickly. And also, patients with attention deficit disorder tend to be excellent hunters,
mm,
right? Why is that? Because they tend to hyper focus and eliminate a lot of other things, right? I remember a patient of mine who was a baseball player, excellent baseball player, professional baseball player, and he needed medication to deal with his life in terms of communication with family, social situations, so he would not be reacting and interrupting impulsively, or to go to a meeting of the team, but he would not take the medication to play,
mm,
right? Because he said, I learned to play with my attention deficit disorder. So if you medicated him when he was playing, you were changing the rules of his brain,
wow.
right? So he will hyper focus. I mean, he was a fielder, and he was actually pretty good. So we need to understand that sometimes, and especially with girls, you're not going to see as much of the hyperactivity. And in our educational system, usually the squeaky wheel gets the oil, right? So it is the hyperactive boy who's not able to sit still, who's not able to play nicely in the playground, who is pushing people around, who is difficult to be with because they're so intense and so hyper, right? Those kids can identify easily, but girls don't,
Mm,
right? And girls have this ability to be more social than boys and less aggressive. So they may work well with others, right? So if you're not hyperactive, you're not as impulsive, but you're inattentive, you may move with the group, right? And I've seen this over the years a lot in terms of girls uh, having had some inattention, but with the work of their group and the teachers and the parents, they make it to grade school, middle school, high school, and then they go to college. And when they go to college, their support system collapses
mm,
and things get really bad. And what happens quite often, and I tell this to my students all the time, they come back from college, first, second semester, they have failed some classes, and they're depressed. And then they get diagnosed with depression, right? They're not depressed, they're demoralized.
yeah.
So you have to, whenever you get a child or a girl that comes from college after being doing well in high school, average student or maybe above average student, goes to college, starts to fail, right? People who starts blaming, well, it's they're partying too much, you know, they're not at home, they're depressed, they're sad. No, 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 no. Look for attention deficit disorder because a lot of these girls are not depressed, they're demoralized because they're failing and they don't know why they're failing.
So, if a child starts getting, you see those behaviors early, you pick them up in school, or in this case, all the way out until college. What are the next steps to help? support this and to make them have a good life.
You see, everything in medicine, whether it's neurological or whether it's endocrine or whether it's rheumatology or heart disease, everything is about how much, how often, and how it affects you, right? And we've talked about this before. So the fact that you have attention deficit disorder with hyperactivity, whether it's combined type or primarily inattentive or primarily hyperactive, which are the three subtypes, regardless of the subtype, what we have to look at is what is that doing to the child, right? Is the illness, and I see this a lot because I treat parents that I diagnosed with attention deficit disorder that now have kids that have attention deficit disorder, and they ask me, should I medicate my child? I say, well, let's assess the kid because we don't medicate the illness. We actually medicate the dysfunction.
Hmm.
So the same thing happens with diabetes, right? Can we treat diabetes without insulin or diabetes medications? The answer is yes. It's not easy, but it can be done. Can you treat attention deficit disorder with medications? Yes, you can. But it depends on how intense, okay, how frequent, and what is it doing to the child, right? So it's not only the presence or the absence of inattention or hyperactivity, impulsivity that we are concerned about. So I always ask the parents, okay, so what is this inattention from your child doing to your child, right? Well, they say, well, it's creating some problems with socialization. Well, we need to look at that. It's creating some problems with learning. We need to look at that. Okay. Then that we need to talk to the school teachers. We need to start saying, well, can you start paying attention to the child that is inattentive, so we can come up with ways to help them. If that is not helpful, then we can medicate, right? But medication has become a point of contention. Actually, it's kind of similar to what happens with vaccinations, right? I mean, you had the believers and the not believers, and everybody's got an opinion, and very few people have facts. So the reality is that if you were born with attention deficit disorder, you're going to have attention deficit disorder for the rest of your life. There is not one medication that is going to take it away from you. And you need to know that because you also need to know that as you get older and you have your own kids, a high percentage of your kids will have some degree of attention deficit disorder that may or may not require treatment, right? So, the decision of treating with medications, okay, should not be taken lightly, but also we should not neglect and condemn a kid who has a severe intensity, frequent all the time, and a lot of dysfunction to not being treated because we don't believe in the
Hmm.
treatment, right?
It's interesting. Again, having gone through this, and I remember the arguments to for and against medication, the response to medication what was tried briefly, and watching her find ways to make it work. Associated with that are things that schools are doing, including things called the 504 plan and stuff like that. Could you explain that a little bit to the audience?
Yes, attention deficit hyperactivity disorder is considered a learning disability, a disability under the ADA, the American with Disabilities Act. So it's a learning issue. So if it gets identified and diagnosed, you're entitled to accommodations in school. Now, accommodations are very different than a special education. This is separate things. And parents always get are afraid because they don't want their kids to be in a special education. But when you identify in school the child with attention deficit hyperactivity disorder, it becomes important they start a process, right, to facilitate the child being able to learn at the same level that other kids. And that includes behavioral interventions, educational interventions, and in some cases, medications. A lot of the referrals that we get to treat these kids come from the school. All right.
Directly from the schools.
Well, the school talks to the parents decide to bring the kids. Some of them do, some of them don't. Um, now, let me present it to you this way. Let's say that you have a child who was born with one leg shorter than the other, right? And it's a special shoe so they can walk and run properly, right? So the 504 plan is that shoe. You want to level the playing field so the kid can be competitive and be able to learn similar to everybody else. So the same thing happens if you get a special shoe. You might be able to go to physical education and you may start doing some running, right? And it's not about just helping the child feel better about themselves. It's about everybody being at the same level as possible. Now, those ideals are not possible because everybody has different genetics, different levels of intelligence, different levels of learning, different ways of learning, right? So, at the end of the day, we'd want to make it as fair as possible for everybody who's in the classroom in terms of learning.
Okay, so these kids that get through, they get the 504 plan to give them some accommodations. What do they look like as adults?
Uh, it depends. That's an interesting question because ADHD in adults has become a big topic lately because finally we decided to accept the fact that this is an illness you're born with and it never goes away, right? So, in my experience, and what we see a lot in the clinical area, is that kids that have attention deficit disorder with hyperactivity continue to be inattentive as adults, right? But you also need to understand that those kids also develop a way of being, develop a personality, and ways of coping with their inattention. Some of them are quite successful, some of them not. What I've seen is that a lot of the kids kind of lose their hyperactivity, but not their impulsivity or inattentiveness. So
Hmm.
some of these people tend to be still somewhat impulsive. A high percentage of them, especially those who were not treated, forget the 401k, because the consequences of not treating ADHD are pretty serious, right? So if you got a 504 plan and you got medications if you needed them, you may become somewhat less um, impulsive, I mean less hyperactive as an adult, but you're still going to be somewhat inattentive. The question is, will they need to continue with the treatment or not? In my experience, about 40% of the kids who were treated properly will still require some treatment as adults, especially those who are very impulsive. Not necessarily because um, of the issues related to learning, but now it's issues related to work performance and relationships. So imagine um, being inattentive and being married to a man who had attention deficit disorder, right? Who has a tendency to hyper focus on certain things. Um, and you have dinner with your husband uh, finished the dinner, everything is okay, goes to watch TV, the news, right? And the wife finishes whatever she's doing, goes and wants to cuddle with her husband, right? And then she sits next to him and it starts touching his head. And then he turns around and pushes her away, right? Why did he do that?
Hmm.
Because he wasn't expecting it, and that's how he copes with things that they're not in his attention space, right? So I tell women or men, depending on who's the one that has the attention deficit disorder, if you want to do something with your partner when they're busy with something else, you better let them know in advance that you're going to do it. All right. So there are issues that are intense that affect your relationship. So as an adult, issues related to work and issues related to relationships become very important because you continue to be impulsive and at times aggressive.
Really aggressive, like physically aggressive?
Well, not necessarily ill intentioned or sociopathically aggressive, but aggressive in the sense that you may blurt some words or you may say something you didn't want to say, but you didn't have the filter, right? You
Gotcha.
didn't have the 3 seconds to think. So it's action reaction. And that creates conflict, right? Because if the other person doesn't know you have attention deficit disorder, the other person is going to have expectations of your reaction being like his or hers, right?
Mm.
In terms of the person who does not have attention deficit disorder.
Now, a minute ago, you said that is actually there's some severe ramifications of not treating ADHD? What are we looking at there?
Well, if you don't identify it, um, what happens is the kid becomes easily rejected. So there's a kind of cascade of events that happen. The kid becomes a bad kid, right? So nobody wants to play with the kid. So the message you're getting is there's something wrong with you. And then you become very defiant. You become oppositional. You don't want to follow the rules. So not unusually, kids that have untreated attention deficit disorder also have oppositional defiant disorder. And then you become very impulsive and self-gratifying. So whatever comes in front of you, you'll do it. You're not gonna spend 3 seconds going to your mind about the potential consequences. So untreated attention deficit disorder has serious complications, including oppositional defiant disorder, conduct disorder, criminal behavior, substance abuse, impulsive sexual acting out. Right? That's what I see in the hospital. And then they become demoralized. You see depression, you see anxiety. So there's some huge number of things. Now, look at it this way: if you grew up totally neglected, impulsive, and inattentive, and you can't problem solve, you basically at a very low level of self gratification. So whatever I need, I'm going to get. So a lot of people in prison have attention deficit hyperactivity disorder that was never treated. Let me tell you why. Because you commit a lot of crimes that are small crimes. Just too many of them, right? So how many times do you run into a Circle K and steal a six pack? You didn't pay attention. There was a police car next to you, right?
Mm.
Those kinds of
So they make bad criminals. That's kind of what you're saying. Which
no, the bad criminals are somewhere else, and we can have a conversation about that later on. I mean, they're not the criminals who sit down and make a plan and follow the plan because they can't do that.
not
So they do a lot
sociopathic,
of
just impulsive.
they're well, they do sociopathic things because they're impulsive and they get labeled as being a bad person and a criminal, and all of a sudden you have a rap sheet with 10 arrests, right? So now the logical consequence of the judicial system is, well, let's send you to prison for 15 years because you're not corrigible. You cannot be corrected. You're incorrigible. So those types of situations lead to complications. I mean, the number of people that get into domestic violence, impulsive sexual acting out, uh, theft, fights. I mean, they tend to be more followers than leaders, but they're also vulnerable to the good sociopaths. And saying it, I shouldn't say good sociopaths, but the functional sociopaths taking advantage of them.
Mm.
So they're like the lower level.
So there's some significant dangers there. So you've mentioned what it looks like. What are the resources that a parent has if they think their child may have ADHD?
Well, the number of things that need to happen is that it starts with you raising the possibility, right? By looking at how's the kid behaving, having difficulty with the grades, having difficulty with uh, doing the chores, procrastination, irritability, right? And then you have difficulty correcting them. They start, telling you to leave me alone, stuff like that. If that becomes consistent, then you need to raise the possibility and ask for help. The school is a good place to start, right? Actually, the schools can evaluate kids. You don't have to go to a psychiatrist or a therapist. Your pediatrician is probably one of the best sources for you to start exploring that. Now, you have to look at the behavior longitudinally, meaning over time, and make sure that it's not a one time event. It's not a photograph. Want to see it? Look at the movie. Look at the consequences. Look at the intensity. And at least raise the possibility of asking for help. I find parents being very reluctant to look for help because they think they're doing something wrong.
Hmm.
Not for the child, but that they made a mistake or they didn't coddle the kid enough or whatever, right?
You
So,
know, you know that you said that, but about my experience. the family that I was dealing with didn't see any problems whatsoever. It took a lot of strength on my wife's part and a lot of kind of red flagging on my part for them to even see it. And I think that can be an impediment to a child also being treated, that the parents don't want to see like there's a problem at all.
Well, and we have to admit that for us as parents, we tend to have some degree of living vicariously by our kids and how our kids do. And if the kids are not doing well, then there must be something wrong with us too. And we need to stop that. You have to look at this like if you have a child right now who's getting epileptic seizures, right? And it's starting to happen more often, right? And now it's happening every day. Would you take the kid to the neurologist? Probably. Well, this is your brain. It's just the brain is not connected properly because of your genetics, and the kid has some abilities that are better than other people, and other abilities that are not. Right? I mean, I and sometimes if you get a number of kids with attention deficit disorder, and you sit them under a tree, and you teach them under a tree, they learn better
Hmm.
because they're not. You see, ADHD people are not made for boxes. They're not made to be put in a box. And I'm sure you know a lot of people like this.
Oh yes.
And yeah, and if you put them in nature, right, they'll do great. And so we choose our careers based on what our brain is giving us, right? So if you have attention deficit disorder, you're not going to be fixing watches, okay? It's just not going to happen. But you may be a great park ranger,
Mhm.
right? So we kind of find our ways. There are some theories of what we call philogenetics, which has to do with what is the purpose of our genetics, and is usually adaptive. And people who said that there was a time when people with attention deficit disorder, because of their impulsivity, hyper focus, aggression to some degree, were the leaders of a tribe, right?
Mhm.
And they were the hunters. They were the ones who left the tribe, go and find food and bring it back. And really, they didn't care if they come back or not. They just wanted to go and hunt, right? So there are people that have that natural ability, and we have to recognize it and try to move the kid toward where their abilities are.
You know, as a coach, that's always something I've done. I was talking about that to some people today. My job is to objectively, and I think that's the tough part with parents, they're not objective about it. And maybe the schools, that's why it's a great resource, to see the talents and the people on your team. And then to do your best to help those things, to put them in the right spot so they can be as successful as possible, and manage the weaknesses. And so, parents out there, you've got some more information now about ADHD. Try to be aware of what's going on with your child. Listen to that school counselor. Listen to feedback of other people without getting upset about it, and process that. And then there's a lot of help out there for you. And as Dr. Patino just said, people with ADHD are not destined to be failures. Some of the probably our greatest successes, probably people like Edison and the like, had some ADHD. Just make sure we can support them, get them in the right spot so they can thrive as well as they can. Thank you again, Doctor, for your time. Thank you, everybody, for listening, and we'll see you again next week.
Thank you very much. We'll see you soon, guys. Take care.